Good morning, everyone. My name is Russell Cook, and I'm the Executive Director of Nevada HealthLink. And I'm joined this morning by Cherie Hughes, who is a navigator. And we're going to be talking for the next few minutes about what a navigator is and what kind of help they can offer to folks who are interested in getting enrolled in health or dental coverage through Nevada HealthLink. Cherie, would you mind giving a brief introduction, and then we'll talk through some questions that should give our audience a better idea of what exactly navigators can offer.
Okay. Good morning or good afternoon, whatever time this is showing. My name is Cherie Hughes, and I'm with the Asian Community Resource Center, where I work as a navigator for Nevada HealthLink. And I help people enroll in the Affordable Care Act, which is also known as the ACA, also known as Obamacare, and here in Nevada, it's known as Nevada HealthLink. And it's a wonderful resource for people that need health insurance. If you don't get health insurance through your job, if you have had Medicaid and because you're making too much money, you no longer have Medicaid, you could come to Nevada HealthLink. It is all income driven, and we help to find you affordable health insurance for you and your family.
That is a fantastic introduction. Thank you, Cherie. So let's dive right into what specifically the role of a navigator entails. So if you can maybe just in your own words briefly tell us, you covered some of this already. I think you hinted at some of this, but if we could kind of drill into what exactly is a navigator and what is your role as a navigator for Nevada Health Link? And if you want to talk a little bit about your background as a navigator, that would be wonderful as well.
Okay, I've been a navigator since 2014, so I'm somewhat of an old timer. I've seen changes in the system, in our computer program, but Nevada HealthLink is going strong and it's gotten much easier to do an application through. Um, what I initially do is I go out into the community and talk to people about Nevada HealthLink and how to enroll on the website, or you can come directly to me or another navigator. We have several navigation entities within the state, and I will give you a phone number before the end of this video, and also the website where you can go if you want to do it yourself on the computer. But as I said, I do outreach. I go to the community and I explain to them what Nevada HealthLink is, what Obamacare is, what the Affordable Care Act is. Remember, all the same thing, and how they can benefit through an enrollment, getting an insurance plan through the Nevada HealthLink.
Okay, great. So it's not just a clever name then. You literally are helping these folks navigate this process, which at times can be kind of complex, right?
Yes, very. Because a lot of people just don't know about health insurance. They think it's pretty easy. They just go to someone, sign up, go online, but it's really not that easy. You've got to look at what your co-pays are, what your deductible is, what your premium, and what kind of coverage you're actually getting. Some people make the mistake of not thoroughly investigating what they're getting. They end up going to the hospital for an accident, and they find out they're not covered for hospitalization, and they're upset when they get a bill that's $60,000 or $70,000. Well, that can easily be alleviated by just having health insurance.
And you mentioned that you had been working as a navigator since 2014. That was the first year that coverage was available under the Affordable Care Act. So really, you've been in kind of you got in on the ground floor.
Yes,
Can
I
you
did.
take just a moment and tell us a little bit about your kind of background story and how you came to do this work, maybe even in the years leading up to 2014 when you started to work as a navigator?
Okay. Well, I was in federal law enforcement for approximately 26 years, and I retired. And for a while, I stayed retired, didn't do anything, and I was finding myself getting very bored. I said, "Oh, let me try something else." So a friend called me and told me about Nevada HealthLink, and they were looking for navigators, enrollment assisters. We've been called different things over the years, and I applied, and I started with Ramirez Group, which they had all the navigators at that time, and we were located on a storefront at the Boulevard Mall. And all our clients had to come there to see us, and we also had brokers and brokers and ourselves there. And it was somewhat of a crazy time because we were all learning still in the process, and people were learning about us. And at that time, it was mandatory that you had to have health insurance. And as we've learned over the years, it is no longer mandatory. And that's something sometimes I have to share with my clients. They don't even know that it's not mandatory to have health insurance, although it's a very good idea. So from there, we progressed and we went out to nonprofits. So there's about 6 or 7 agencies throughout Nevada that have navigator entities such as myself to help the community to enroll in health insurance. So it's no reason you can't find someone to help you to get health insurance.
Sure, that's a great point. So in-person assistance obviously is always available, but you can get started over the phone, right? I mean, if a consumer wants to call, maybe learn a little bit more, maybe make an appointment, perhaps they can
Yes.
start on the phone. Maybe you can help them through the process on the phone if they're not able to come in and see you. But in-person assistance is still something that we provide and have since day one, right?
Correct. And I always try to do one on one. I make time to sit down and be able to explain to them uh, why why they should and help them to make a choice. I don't choose for them. They choose their own health insurance. And we have approximately 7 different health insurance providers with Nevada Health Link. So you have a variety to choose from. And it's all based on the information that you give us, with your income being number one. And I wanted to mention that what makes Nevada Health Link very important is what we call the advanced premium tax credit. And what that is it's based on your income, and the government can come in and help you pay your monthly premiums. So that helps it to be affordable to some families. And
So
that money goes directly to the insurance company that you choose.
I didn't mean to interrupt you, but so the bottom line for consumers is that these tax credits can actually reduce the monthly premiums that they have to pay to their insurance carrier each month, right? So right
Yes,
out of the gate, from the very first day that you enroll for that first month of coverage, you're saving money depending on your income, of course. You're going to save a certain amount of money that'll be reduced or taken away from the premium that you actually have to pay.
correct.
All right, so that's very important. That's the key for a lot of our enrollees. So let's talk just a little bit more about you personally, and we'll talk a little bit more about the nuts and bolts of navigator assistance and
Okay.
enrollment in general. But I wanted to ask briefly, what do you personally enjoy the most about being a navigator? You've been at this for some time now. Wondering if you have any standout. Obviously, you must like it. You've stuck with it for 10 years, right? But if you could help us to understand, maybe what you really enjoy, what benefit you get out of being an actor.
Okay. Well, as I said, I came from a totally different background. So I didn't know very much about health insurance. And after I learned it and I meet people, I get to go to different places throughout Nevada, Mesquite, Laughlin, and different places. Our back to school outreach programs. We're in the hotels sometimes. We're in recreation centers, and I just meet a variety of different people. And people are still pretty good out there, and they want to know what. And I like to help them. And unfortunately, some of them have a misinformation about Nevada Health Link because people say, "Oh, will tell them it's too expensive. You don't get this, you don't get that." And I'm telling them, some Nevada Health Link is one of the best insurance programs going if you don't qualify for Medicaid or you don't get a great insurance plan through your employer. And just to see people happy when they leave the table after enrolling because they got a good health insurance. They have peace of mind now for not only themselves, but their spouses, their children, even their parents. And that's a lot of fun. And like I said, most of the people I meet are very pleasant, and I feel like I have contributed to my community. I was born here in Las Vegas, and I want to see good things happen for this town and for the people. And Nevada Health Link does that for me.
That is so wonderful to hear. It does that for me as well. I get no shortage of gratification out of the work that we do here at Nevada Health. Like, and I'm so glad to hear that from you as well. And
Yes.
I've had the pleasure of meeting a number of our navigators throughout the state. That seems to be a common theme, is that personal connection really matters. And I really want to underscore again the importance of this in-person assistance and the relationship that you can form with the navigator community. If you're out there, if you're uninsured, if you're an uninsured Nevadan, or even if you have insurance but you think you might be able to do a little bit better, maybe you think your income might qualify you for some of those premium reductions that we mentioned a moment ago. Really want to encourage everyone to reach out, find a navigator in your community, even just have a conversation. They will help you learn and understand about what we have to offer in a very low pressure kind of an environment. So really want to encourage everyone to reach out, make those relationships, and learn a little bit more about what Nevada Health Link has to offer. So really appreciate those reminders, Cherie. Thank you. So let's talk a little bit more about nuts and bolts here. So, I wanted to ask, we've covered some of this already, so we don't need to go, we don't need to repeat ourselves necessarily, but was wondering if we could talk a little bit about how you help Nevadans in the process of getting connected to health insurance. If I'm a brand new consumer and I'm not really sure, I'm uninsured right now, but I'm not really sure what the next steps are, how do you help me kind of get started in terms of understanding what my options are?
Okay. Well, whether it's on the phone or in person, I'd rather see them come down to see me, but I can work either way. I first ask them what are their needs, what are their family needs. We have to make sure they qualify for Nevada Health Link, and then once we get there, I have to ask them, what is your budget? Because I don't want to get them to get a plan that's too expensive for them, because then they'll be just miserable, and sometimes they won't make payments, and then the health insurance would cancel. So we want to make sure everything's going to go very smoothly. So I sit down and kind of get a feeling for their needs. And then I let them know that there's no pressure. If they choose not to go with me, they choose not to choose a plan with Nevada Health Link, that's no problem. They have my number, my cell number is on my business card. Call me anytime if they have questions about insurance, and I will help them. I'll do referrals to, if I can't assist them, I could send them to a broker or another one of my colleagues. We have people that speak different languages, so there's no language barrier. As I said, we're out in the community. If they can't come to me, there's probably a place closer to them that they can go and talk to that person. I explained to them what Nevada Health Link is. And one of the most important features of Nevada Health Link is they cannot say no because you have a pre-existing condition. And as we know, some insurances can't, well, they are doing it. But if you have diabetes, if you have heart problems, if you have cancer, we ask them no questions about their medical condition. That's all for them when they get the plan and they go talk to their doctor. So I try to make them as comfortable as possible, and just tear down all the barriers that have kept people from getting health insurance.
Wow, there's so many good reminders in there. One that I wanted to call it in particular, you mentioned that support is available, or assistance is available rather, in a variety of languages. And I wanted to mention that we just recently completed a study here at Nevada Health Link looking at all of the written and spoken language preferences that are reported by applicants to the Nevada Health Link platform. There's a page in our application where you can specify what your preferred written and preferred spoken language is. And we have navigators throughout the state that can offer in-person assistance in every single language that was reported by consumers as being their preferred written or spoken language. So chances are very good that even if English isn't your first language, even if Spanish isn't your first language, we have a navigator out there who can help you. We have a number of navigators who can offer in-person assistance in Korean, Mandarin Chinese, Tagalog, Vietnamese. So really a great point there that we can offer in-person assistance, not just in English or Spanish, but most likely in any other language that a Nevadan has a preference for. So
Yes.
wanted to talk a little bit about ways that Nevadans can get connected with navigators. So what's the best way? What advice would you give as far as how a Nevadan can help find you in the community and get in touch with a navigator organization?
Okay, well, I'm going to reach out regarding our going online, which would be let's see, NevadaHealthLink.com. You would go to that site. You see heading Partner Resources. Click on that. Then it would bring up Broker/Navigator Resources. Click on that. And information for NV Broker and Navigator partners. You could go into there. You could find names of the different navigators or the entities that they work for. And you can also find brokers. Another way to get in touch is to call the Nevada Health Link helpline, and that number is 1-800-547-2922. 627. And one of the courteous operators that answers would be more than happy to assist you. They'll sometimes ask what your zip code is so they can find somebody in your area. And also going out to different events within the community. Usually we are present in one form or another. Nevada Health Link, you'll see our booth with the big banners and giveaways, by the way. We have all our flyers, and we're there to help you. So if you get out to a back to school event, if you get out to just some type of whatever event is happening in your neighborhood and they're having a big fair, so to speak, we usually will be there to help you.
Wonderful. Okay, great. So, a variety of options. I wanted to mention also that we have a tool called our Find Local Assistance tool that's available through our website. Variety of great options, and it sounds like
Yes.
people may just run into a navigator in their community if they're going out to an event. So, a lot of great options there.
Okay.
Let's move on to, okay, we talked about regularly scheduled events a bit. Can you maybe just tell us in a little bit more detail? I think we refer to it as tabling, right? We go out to these events, we set up a table. There'll be Nevada Health Link logos all over the place. We'll have some handouts, maybe some brochures. Are there, and you're down in Clark County, right? So can you maybe talk just
Yes.
a little bit about what specific events maybe over the last few months you've actually gone out to, just to give people some idea of, what type of events we maintain a presence at?
Okay. Well, I spoke of events, but I want to tell you we are always in the Meadows Mall, the Galleria, and the Boulevard Mall. You could find navigators there in some of the storefronts. Also, let's see, recent event. Well, I keep mentioning back to school. There's a lot of back to school events where different organizations give great things for the kids to start school in. We are always at those events. We're at expos. I was just at the an event up at the Rio. They're getting ready to have a conference in January, and so I went there and I was giving out some. We didn't have a booth. I was just there, mixing and mingling with the other participants, letting them know that Nevada Health Link is available. One of our hotels here just recently closed because they're going to be building a new hotel on that site. So all of those employees that don't have alternate insurance plans are going to need Nevada Health Link. So we were there to give them information. Um, and we sponsor many events. We sponsor luncheons that we invite the community to. And we give not only the information about Nevada Health Link, but other referrals within the community. We even help people with the Medicaid enrollment and understanding how to use their Medicaid. So we one stop for Nevada Health Link. Um, Geez, I'm trying to think other places we've been. We get to fairs. I've gone to Logandale to a fair out there. Yeah, and it's sponsored by one of the entities in that community. And oh gosh, sometimes we have about 50 different vendors from all over the community, and we tell the people about Logandale, and what kind of insurance plans that are available to them out there. And
Okay.
we have our also navigators in Reno that I'm sure do the same thing. And we're also at UNLV and community college to help those students navigate through health insurance.
Oh, that's so wonderful. So let's say that I'm an event organizer. Can I invite navigators to participate in the events that I organize? And if so, are there any restrictions or guidelines for navigators to participate, or do you have any advice for event organizers as far as how to get a navigator to set up a table at their event?
Okay. Well, they usually will get the word out through various newsletters. Many of the navigators, including myself, will go to different community meetings and we'll hear about different events coming up. It's amazing how word still spreads. While our town is growing so quickly, people still know one another and the word gets out. So please, I encourage any company is having any kind of event, please invite us. Now, know that our funding is not great to pay a whole lot of money for a booth, but we're willing to come to bring all of our resources to try to educate your attendees. And as far as any restrictions, I don't think there's anything because we don't sell anything in our booth. Everything is free, including the information. And if they don't invite us, we will call them to try to get an invite.
Okay. Okay, so it sounds like folks who might be interested in event organizers, let's say, who might be interested in having navigators at their event, they can just reach out the same way that consumers can reach out, right? They can use our search tool or some of the
Yes,
options that we discussed earlier to get in touch with your organizations, and then you
yes,
can help them take it from there, right? Is that a
cor-
fair statement?
correct. We have pastors, ministers, priests from churches giving us a call, asking us to come to some of their services after
Okay,
service and letting their parishioners know about Nevada Health Link because they know how important it is to have health insurance. And oh God, we've just been all over town. I tell you, we get into casinos, we get into even bars have events, and we will go to those to help their parishioners because it doesn't matter who you are. Everybody needs health insurance,
sure,
and we
sure.
try to make it readily available for anybody, and we try to explain. I've had people come to me, and they're not necessarily they have insurance, but they want to know what do we offer
Mhm.
and a comparison, and I have no problem in doing that for them.
That's a really good point. So if I'm insured and I just want to find out if I'm getting the best deal possible, or maybe I'm leaving some money on the table, that's a question that a navigator can help answer in a hurry, right?
Yes, we just have to get a little information. As a matter of fact, there is in our application, well, on the website, we can go and shop and we can even give them an estimate of what their insurance would be with us. We just have to explain to them the rules or regulations of what it would take to enroll. There are certain things you have to have or don't have to get Nevada Health Link. And if
Sure.
you're offered affordable insurance, and we have a equation that we figure that out through an employer, you'd have to go with your employer. But what's important to know is your family. If you add your family to your employer's plan that you have, sometimes the rates go tremendously high, and some people can't do that. So if they come and bring their family and enroll them in a plan, they still get their APTC, and it's
Sure.
usually cheaper. So that's a big bonus, and people sometimes don't realize that.
That's a really great example you just shared because, in my mind, that speaks to a lot of the value that a navigator, with the expertise that you have in terms of your holistic understanding, not just of the monthly premium that you're going to pay, but you also mentioned earlier in the conversation about what your out of pocket costs are going to be for medical services, for deductibles, maximum out of pocket. That's when things start to get really complex. So, you mentioned more recently, just a moment ago, the cost estimator on our website. You can put in just
Yes.
some basic information, household income. You have to put in your geographic location in the state, your zip code and county, because not all plans are offered, in every area of the state. But it doesn't
Yes.
take long at all to figure out what your monthly premium is going to cost and how much of those tax credits you mentioned earlier you're going to qualify for. But that's just part of the puzzle, right? You have to understand, do you have any medical conditions? How often are you going to be seeing doctors? Do you have any prescription medications that you need to make sure are covered,
Hmm.
that sort of thing? And, in my mind, that's really, where the value of a navigator really starts to become significant. And I think that really speaks to the many ways that navigators can help consumers to literally navigate this process and find the health plan that's best for them, which might not necessarily be the one that costs absolutely the lowest each month. You have to kind of take that long view, right, of what are you actually going to be paying for over the course of a year of coverage for you, maybe for your family. So really appreciate those reminders. All right, Cherie, I just had one last question for you, and I know we
Yes.
covered some of this previously, and don't want you to necessarily repeat yourself, but I wanted to give you an opportunity to share what you would like the public to know about Navigator, some of your kind of your main takeaways over the years of assisting consumers. If you had to kind of summarize some of the most important points for consumers to understand about our Navigator community, would love it if you could share some of that wisdom with us now.
Okay. Well, navigators are people just like they are. that are out there to educate them about health insurance. And no question is stupid. We could sit down and go through the Nevada Health Link and what it offers, how they qualify, that they don't have to worry about a pre-existing condition or getting kicked off their insurance plan if they use it or if it's going up. One thing that's important about Nevada Health Link is that it covers almost everything you need. The 10 essential benefits. We talk about how they need to remember they have to pay their premiums, about the APTC, the advanced premium tax credits that they will get. And at the end of the year, they have to report that to the IRS, which shouldn't be a problem. I try to make sure they have no surprises when it comes to their health insurance. Making sure that they know how to call once they get their card from the plan they have chosen. They have to be proactive instead of reactive on their insurance. Calling, getting an appointment. They're paying for this, so they should use it. Preventative is very important. So it will catch possibly cancer, heart problems, diabetes, things like that, that we cover prescription medication and how that works. And just sit down and not physically hold their hand, but go through the plan and tell them what to expect and how to use it.
That was so wonderful. Well, I can't thank you enough for your time this morning, Cherie. I'm deeply grateful, especially for your, I guess we're coming up on 11 years of enrollment assistance that you've
Yes.
offered to, I'm sure, thousands of Nevadans. So thank you so much for doing what you do. Thank you for sharing your knowledge and your wisdom with us today. And thank you most of all for encouraging Nevadans to seek out some assistance, some advice from the Navigator community. Again, just a reminder, if you're uninsured or if you have insurance, but you just want to know if you're getting the best option that you can, please don't hesitate to reach out to our Navigator community. Again, you can find them through our search tool at nevadahealthlink.com. There are a variety of ways that you can get in touch with navigators. You might just run into them if you're active in your community, maybe at a farmer's market or some other type of event out there. So thank you so much, Cherie. Really grateful for your time and all the information that you shared with us this morning.
Thank you.